Hi viewers, welcome to my channel, sensitization channel. My name is Nurse Onyimowo, and today we shall be discussing pre-eclampsia. Please, if today is your first time of coming across my video, please remember to subscribe and turn on the notification button so that in subsequent video you'll be notified. And please share to families, share to friends, especially our mothers, in order to reduce the rate of morbidity and mortality occurring from pre-eclampsia. Pre-eclampsia is a disorder in pregnancy which is characterized by increased blood pressure, protein in the urine, and swelling of the body, either the legs or the hand, and also the face is puffy. All this can be detected from routine antenatal checkup. It is very important that if you noticed severe headache, even if it is not your date to visit the hospital, please try. If after taking enough rest and the headache still reoccur, please visit the hospital so that your blood pressure will be checked and your urine will be tested to see if there is protein, because early detection of pre-eclampsia have saved a lot of lives. What are the signs of pre-eclampsia? Like I've mentioned, headache. When you have unexplained headache even after a good rest, when you see your legs and your hand swollen, when you feel unnecessary tiredness, when you feel pain in between your chest and your abdomen under the rib cage, when you notice that you are gaining weight excessively, all these are signs of pre-eclampsia. And also, if your blood pressure is checked and there is elevation, increase in the blood pressure than the normal and usual one you normally have during your routine antenatal, more investigation will be carried out to ensure that it is not pre-eclampsia. And also urinalysis, urine test. It is very important. If there is protein, further investigation will be carried out to ensure that it is not pre-eclampsia. When you have blurred vision or you feel like you have a light flash on your eyes, all these are signs of pre-eclampsia. When you also have shortness of breath, you cannot breathe well, it's also a sign of pre-eclampsia. Nausea and vomiting. Although nausea and vomiting is part of pregnancy sign, but when it is excessive or when it is excessive above 30 weeks of pregnancy, report to the clinic or the hospital where investigation will be carried out to ensure that it is normal. Pre-eclampsia have claimed a lot of lives, our mothers and our babies, and as such, it should be treated as urgent and emergency. Please, if you notice all these signs that I've mentioned, do not hesitate to visit the nearest hospital. Even if you travel and the clinic you register, you can visit the nearest hospital so that it doesn't get worse to take your life or the life of your unborn child. Who are those that are prone to have pre-eclampsia? Those that are prone to have pre-eclampsia. Number one, if you have multiple pregnancy, that is carrying more than one baby. If you have diabetes or hypertension before pregnancy, this This can prone you to have pre-eclampsia, and that is why it is advisable that before pregnancy, a thorough check will be done to ensure that you don't have high blood pressure or diabetes, and if you have, you'll be placed on drugs to control it, because if it is not being controlled during pregnancy, you can have pre-eclampsia. Then having pregnancy within the gap of 10 years can also prone you to have pre-eclampsia. As such, too much gap in between pregnancy is also risky. Over 35 years and being pregnant for the first time, which we call elderly primate, also can prone you to have pre-eclampsia. And if your previous pregnancy was complicated, and also if you had pre-eclampsia in your previous pregnancy, obesity can also prone you to have pre-eclampsia. It is important to maintain a healthy weight before pregnancy. Pre-eclampsia have caused a lot of harm to the society, and many families have been left in tears because of pre-eclampsia. Please ensure to attend your antenatal regularly, and also go when you notice any of these signs, so that your blood pressure or diabetes or hypertension will be under control, so that the preeclampsia will not be complicated to claim your life and the life of your unborn child. In our subsequent video, we shall discuss the complications and the treatment of preeclampsia. Thank you.